on the San Luis Obispo County Comprehensive Prevention Plan, a committed alliance between the County of San Luis Obispo Department of Social Services and the San Luis Obispo County Child Abuse Prevention Council. We will be sharing with all of you growth opportunities and lessons we learned during the partnership between the department and our local Child Abuse Prevention Council in developing our comprehensive prevention plan. Next slide. My name is Nancy Kuster, and I'm the Deputy Director for the San Luis Obispo County Child Welfare Services. Before us is our agenda. For now, we will be taking the opportunity to quickly introduce ourselves right now. We will start with Lisa Frazier.
Good morning, everybody, and my name is Lisa Frazier. I serve as the Executive Director for the San Luis Obispo County Child Abuse Prevention Council. We are the nonprofit home for the Center for Family Strengthening and the Link Family Resource Center.
Thank you. Sandra Jimenez.
Good morning. I'm Sandra Jimenez. I'm a program manager in Child Welfare Services, overseeing prevention in San Luis Obispo County.
Thank you. Gwen Garcia.
Hey everybody, Gwen Garcia with Parent Connection of SLO County, a program housed at Center for Family Strengthening, and excited to be here. Thank you.
Thank you. After reviewing the history of the department's partnership with the Child Abuse Prevention Council, we are going to share how we are implementing motivational interviewing within the department, as well as with our community partners and stakeholders. Then we will have an overview of the Parent Leadership Institute of San Luis Obispo County and the good work they are doing. We will end with questions and answers. Next slide. Lisa, I think this is you.
So thank you, Nancy. Nancy and I have been working together this past year and a half. Before that, we had Linda Belch, who served as our Deputy Director of Child Welfare Services. Back in 2019, we all participated in the San Diego conference to organize our stakeholders around how we would develop a child abuse prevention plan. And we got to work, and we were very vigilant about coming together in this partnership between the Child Welfare Services and the Child Abuse Prevention Council. Any other thoughts, Nancy?
I'd like to add that I am a new Deputy Director for Child Welfare Services here, and I started in February of last year. And so I did jump in mid-process with this, but it has been a great way to partner as I continue to learn my position. Thank you, Lisa.
You're welcome. So when we got to work back in the day, this was right before COVID, we continued to meet and we continued to pull ourselves together in this partnership between the Department of Social Services and the Child Abuse Prevention Council, where we co-organized 22 agencies to work with us and help us identify what we consider in our communities existing primary and secondary and tertiary level prevention programs in our county. So through this process, we worked at developing an asset map where we understood the 72 prevention programs available to individuals and families in this in the county. I have to say this was the first time that it was done, and it was very ambitious. It's not that it wasn't easy, but it took work, and it took high-level coordination on the behalf of the Department of Social Services in partnership with the Child Abuse Prevention Council. What we came to recognize was that some programs require referrals and serve specific demographics, which I think is not unique to us, but also what we did it together to learn together, while others can be self-referred with no specific targeted demographic. Again, I want to really emphasize that this was really an opportunity to do this in partnership between a community-based organization, the Child Abuse Prevention Council, and our Department of Social Services. Our co-leadership helped us move along in this process. During that time, we clarified and identified 3 things. We have primary gaps in services in the North County region, which is a mixture of small cities and rural communities. This historically has been the case, but together we came and recognized it in this plan, how we were going to highlight and emphasize the need in the North County. We also, as a group, identified populations needing prevention services, such as at-risk youth, ages 12 through 17, pregnant and parenting youth, as well as homeless youth. Again, I want to emphasize our co-work and partnership on this was something that had not been done for quite a while. And then also motivational interviewing was chosen as an evidence-based practice for the comprehensive prevention plan. And Sandra Jimenez will be talking more about that in the next part of the presentation. Next slide. So here are our primary and secondary strategies. It was with the partnership between the Department of Social Services and this Child Abuse Prevention Council that we agreed, along with our stakeholders, to establish a high-performing child and family wellness collaborative, which you'll hear in a little minute. Now, we recognize there are multiple collaboratives, there are multiple networks in our community. They all are very highly collaborative, and what they require is high-level coordination. And this is what the Child Abuse Prevention Council brings to this project. Also, the Department of Social Services they launched a countywide motivational interviewing trainer of the trainers network. You will hear more about that in the next presentation. And also design and coordinate a parent leadership pathway. This has always been a desire and a vision, but never highly invested into with appropriate resources to get it going. And you'll hear more about that. Anything you want to share about this slide, Nancy, before I move on?
No, thank you, Lisa.
Okay. So here we are. We're going to talk today about the Child and Family Wellness Collaborative in San Luis Obispo County. And we are a united system of prevention resources, supporting families to provide stable and nurturing relationships and communities for their children. This requires high-level coordination, which I'm here to talk about on behalf of the Child Abuse Prevention Council. Our aim is uniting leaders to prevent child abuse and neglect. It takes a lot of effort and strategic thinking to work on shared priorities across programs and agencies. We need to constantly cross-communicate, not just at the meeting, but after meetings. We improve our decision-making capacity due to the improved knowledge sharing, which you'll hear about. We take opportunities to look at the data. We share the data across our systems so we understand where they are today and how they have progressed over the years. Also, strategic and timely response to community needs with the support of trusted partners. We depend on each other here in San Luis Obispo to cross-communicate at all times. The challenge is constantly nurturing those trusted partnerships does take time and extra strategic effort. And the collaborative is a forum and a place to come to make sure that we reinforce those relationships and our shared goals. What you see here is an example of our collaborative prevention partners. All the same entities and agencies I imagine you too work with in your counties. But our focus is this. We're serving children, agencies that serve children 0 to 18, also unaccompanied children, youth, and parents, caregivers, and families. That is our focus. Prevention of child abuse neglect is a focus, and our early intervention services are our lens. Again, partner roles, as we list here below, are important to us, that we have people in the room that are in a position to influence policy, but also make decisions. The challenge is always organizing this, always pulling it together, because we know what happens. People don't always stay in the jobs that they were originally showed up for. And we are constantly bringing in new folks, but also other agencies that are going through transition. One of our strategies is to focus on making time to orient new people outside of these meetings with a small 30-minute orientation, which has proven to us to be very successful. So we improve the understanding of the purpose of the collaborative and how it fits in your agency's or community-based organization's mission. What drives this is our shared prevention data practice. This is key. Here is an example of the 4 meetings that we are coordinating that happened in August, October, most recently February, and May. We are scheduled to meet again. I want to highlight that in August, the child welfare system data comes from our colleagues at the Department of Social Services, obviously, and Nancy Kuster and Sandra Jimenez have been key in this partnership to make sure that we have this kind of data for us to look together at in one collaborative meeting. We have focused on what we call an indicator, a wellness indicator on food security. There are so many wonderful people and groups doing this work, but rarely do we really understand the food security issue in one setting. And we hope that was our focus in October. We spent time on Friday looking at our children and youth experiencing homelessness data again in one setting. What was most powerful about it was the conversation that came out of it about not just what we know about the problem, but we had representation that was bringing up how do we understand the needs of those children who are not school-aged and how difficult it is to track that. No one really, it was a really important aha moment at that time. And then in May, our safe system of care referral, which is our family resource centers, understanding that information is how we're going to be spending our time in May. Lastly, we want to give you an example of what we created in the very beginning of our collaborative of a community data snapshot. This was really focusing on pregnant and parenting teens. It was going beyond just spewing or saying things at a meeting and saying, this is what we know about the problem, but giving us a template that we could build upon in the future for a wellness indicator. In this case, we practiced this. Again, an example of a data sharing practice in our county on what we know about pregnancy and parenting teams and how they are being served. And then another example, and that would be in trends over time. And again, we all know how much time it takes to create these data slides. We all know how much time it is to take any take care of any data monitoring in one single agency, and that is our challenge. How to build this into our practice in a collaborative setting is the work of this collaborative, and we have come away with a much better understanding of each other's work in each agency. And then I will end it here. I'm going to hand it over to Gwen Garcia, Program Director of Parent Connection of San Luis Obispo County, where she'll talk about the Parent Leadership Institute of San Luis Obispo County.
Perfect. Thank you so much, Lisa. So hi, everyone. My name is Gwen. I'm a program director, like Lisa said, for Parent Connection of SLO County. We are a parent education resource and support program for all families and caregivers in San Luis Obispo County. And the investment into this program provides these services for free to the parents and caregivers in SLO County with a diverse background. We're a program housed at Center for Family Strengthening. So I'm here to talk to you about how we've evolved our parent leaders and given them a platform and a pathway in SLO County through our comprehensive prevention plan. Next slide, please.
Oh, sorry, it's not moving. Sorry, Gwen.
That's okay.
Let me stop sharing and I'll come back on again with a share and see if that will work. And
While Lisa is figuring that out, this is a prime example of how we need to be flexible in the moment and just continue doing the work. You know, we teach our parent leaders in the pathway that things don't always go right, but what can we learn from it? How can we move forward? And so as she's pulling that up, I'm going to continue talking because the slides are really there to give an illustration, but the talking is really going to deliver the information. So, as we learned from the lived experience panel this morning, for people with lived experiences, the most meaningful moments that provide hope and things to look for were the resources that helped provide them with their to meet their needs. And as they moved forward, part of their healing is having a place for them to share their lived expertise and give back while being supported. So, with that being said, I want to highlight the significance of parent leadership and how it benefits families, but also strengthens our communities. One of the primary focus areas identified in our prevention plan was the development of parent leadership and really creating a pathway. So, to achieve this goal, oh, there we go.
yeah.
Perfect, you're on the right slide. So, to achieve this goal, the Department of Social Services for SLO County partnered with Center for Family Strengthening to help coordinate prevention efforts in SLO County. And this collaboration includes a dedicated budget aimed at creating a robust parent leadership pathway among different coordination services. So, in order to do parent leadership, we really know that there needs to be a dedicated budget to support staff to develop and create. In my exploration of various parent leadership models, I found that many existing frameworks often involve bringing agencies from outside of SLO County to our county. And while these external models have significant and great advantages, we truly believe that having a program that is run by people that know our county landscape was really important for the sustainable pathway. And it's essential that this pathway is local and guided by the voices and experiences of those who understand the unique needs and strengths of families within SLO County and understand the resources in SLO County. By prioritizing a local model, we empower our families and foster their ability to thrive together. So, as a result of this vision, I'm excited to introduce the Parent Leadership Institute. This initiative serves as a foundational learning pathway designed specifically to engage parents and caregivers in the family strengthening field in a strength-based and trauma-informed manner. Our goal is to elevate lived experiences, enabling participants to provide valuable insights into the systems and resources available in SLO County.
Gwen,
So,
am I
yes,
on the right slide, Gwen?
you are. You
Thank you.
are.
Okay, right.
Thank you. Thank you so much. So we just launched cohort number 2, and in this picture, you see our cohort number 2 at their orientation. This cohort was launched at the beginning of February. It's comprised of parents and caregivers with children 0 to 18 years old, living with them at least 50% of the year. All of the parents and caregivers participating in the program have lived experience utilizing support systems or have had formal system involvement. So that lived experience is really part of our application and how we process and choose our participants. The application process was a 2-month recruitment. We created a newsletter that went out to over 1,000 parents that are signed up with our newsletter delivery system, as well as social media posts, and connected with partner agencies such as Department of Social Services, CWS, as well as other community-based organizations in SLO County. And we really invited them to refer parents that they were working with that they see would be a good fit for this institute. Parents and caregivers could also self-refer. So if they saw us on social media, they would just press apply now. And that was probably about 80% of our applicants were self-referrals. So to talk about the Parent Leadership Institute, it's a 4-month, 20-hour commitment with dedicated activities to participate, learn, and grow their leadership skills. These activities include learning sessions about family strengthening efforts happening at a state and in our local level. We also focus on personal growth through one-on-one coaching, as well as we use the Clifton Strength Finders assessment to really identify what their strengths are. Oh, can you go to the last slide, please? And we also talk about how to use their experiences to help other parents and provide feedback on systems and supports with their participation at the Child and Family Wellness Collaborative. So each participant who graduates receives a stipend for their time and participation in the Institute. They can also participate in additional meaningful engagement opportunities and earn gift cards outside of the stipend. So we have a set number of activities, but as things come up, like this convening that we're all at, we offer it to the parent leaders. If they would like to attend and learn more, we want to support their time in that. And so we offer gift cards and stipends to do that. Okay, next slide, Lisa. So as I mentioned about the application process, part of that screening process is to look at lived expertise, where the person lives in the county, and the availability to participate in the Institute. We want to create diverse groups in these cohorts, so people with a variety of different lived experiences, as well as people that live throughout all different areas of our county, not just one city. So we know that parents and caregivers are experts in their own families and that their lived experiences can help advise service providers on how to improve and ways to decrease child abuse and neglect. So we learn from their process on how to improve what we're doing. We welcome diversity and foster a non-judgmental and safe environment for parents and caregivers to feel welcome, to ask the questions they really are curious about, and safe to provide their feedback on how their time and support was through receiving the services, as well as providing feedback on what they would like to see in the future. Their lived expertise provides valuable, crucial feedback as resources and systems are being implemented, developed, and done in SLO County. Next slide. So to launch the parent leadership pathway, we knew we needed parents to help develop it. So it's the old saying, nothing about us without us. So you may be wondering, how did we get to cohort number 2 with this framework? Were the steps you took a comprehensive what were the steps to get to this comprehensive model? And did this happen overnight? So those are all great questions to be thinking. During our first year, we recruited 2 parents to help us build what is now known as the Parent Leadership Institute of SLO County. They helped us by bringing their parenting journey and their lived experience to say, hey, this is what I would need in a pathway. These are the things that I would want to understand to be able to really give back in a meaningful way. So through the first year, the parent leaders identified a variety of
Gwen,
lessons learned.
you
Yes.
have 1 more minute.
Okay. Perfect. So the Institute originally was done for 9 months, and the first cohort reported that we needed to really move it to a smaller, more manageable time, which was a 4-month commitment. And that's what we decided to do. And so eventually we hope to have levels of parent leadership pathway. And then we also identified there needs to be a clear schedule of activities. They helped us identify topics that they were interested in. And lastly, they identified that the cohorts need to be at least 5 people. 2 people was too small, and so they wanted 5 people. So to wrap up my time here, I want to encourage you that in the HUVA application, there is an orientation packet attachment, and it really is given to our parent leaders that are accepted and participate in the program. And it's got my information on it. So if you are looking to create a parent leadership pathway in your community and you don't know where to start, I would love to connect with you, and my information will be at the end of this slide as well. So thank you very much. And now I'm going to hand it over to Sandra to really illustrate how we're using motivational interviewing in our community.
Thank you, Gwen, and good morning again. Thank you all for being here today. My name is Sandra Jimenez, and I'm going to go over our implementation of motivational interviewing in San Luis Obispo County, and I'm going to share some statistics from our trainings as well as lessons learned. Next slide. The County of San Luis Obispo implemented motivational interviewing as our chosen evidence-based practice and began training in August of 2023. This aligns with the Family First Prevention Services Act requirement to integrate an evidence-based model into child welfare services. This decision was informed by that asset mapping findings that Lisa presented earlier, which they identified motivational interviewing as a key approach to enhance and engage families and youth. To ensure effective implementation, we partner with Motivational Interviewing for Change to provide training and coaching for child welfare staff, as well as community partners. This partnership supports a structured and consistent approach to MI across the county. Training is offered both in person and virtually to ensure accessibility, and we have established an oversight to monitor the process and ensure that MI is applied with fidelity in practice. A critical component of maintaining fidelity is the Motivational Interviewing Competency Assessment, also known as the MICA scoring tool, which evaluates trainees' proficiency in MI techniques. So trainers use this MICA score to provide targeted coaching and feedback. And through multiple coaching sessions, the goal is to ensure that all trainees develop strong MI skills and consistently use a client-centered approach when they work with families. This structured approach helps us uphold best practice, reinforce staff competency, and ultimately improve outcomes for the families that we serve. Next slide. And I know we're kind of short on time, so I want to make sure that we have time for questions. This slide is going to review the training statistics. So we started motivational interviewing back in August of 2023, and we will continue through June of 2025. So far, we've completed 8 cohorts, both in person and virtually, and another session is scheduled for March of 2025. We've trained 78 child welfare staff. That includes case carrying and non-case carrying social workers, supervisors, and managers. Additionally, 82 community partners have participated, and that includes therapists from behavioral health, mental health, nurses from public health, school liaisons, family advocates, parent leaders who work in prevention services, supervisors, and many more. That means that a total of 160 staff have been trained in MI in our county. Next slide. Not all trainees receive the motivational interviewing competency assessment coaching. This was specifically provided to those in child welfare and those preparing to be a or going to do the train the trainer model. The goal was to ensure that trainers have a strong foundation in motivational interviewing before coaching others. So coaching sessions were conducted virtually, where trainees practice MI skills in realistic client scenarios. An actor portrayed a client, allowing trainees to engage in a meaningful hands-on practice. Additionally, if the trainee had a specific case or challenging situation, they would request customized scenarios to tailor the coaching experience to their needs. This would ensure that coaching was relevant and applicable to their daily work. A total of 84 staff have received this coaching and feedback. And next slide. To become a trainer, staff follow a structured process. It begins with a 2-day motivational interviewing foundations training that also includes advanced training, followed by an intensive 3-day training specifically for trainers. They then complete 4 MICA coaching sessions and an additional 6 hours of coaching to practice leading a motivational interviewing class in person. The trainees are also required to train alongside a certified trainer for hands-on experience. Their last step is to attend a 3-day MICA scoring tool training to further refine their skills. This is the last item we need for our trainers to do in our county. We currently have 10 participating trainers to train on motivational interviewing. And next slide. And as we all learn, there's always some lessons that we have learned in this MI implementation. So training alone is not enough. Ongoing coaching is crucial to enforcing motivational interviewing skills. Supervisor engagement is key. So supervisors who support MI allow staff to be more likely to apply it effectively. Having a multi-level implementation strengthens outcomes. So integrating MI at all levels improves consistency and impact. Resistance to change is normal, and ongoing coaching supports staff adapt and build confidence. A strong leadership drives sustainability. So commitment from leadership from the higher up ensures MI remains a long-term practice. And I believe that's the end of my slide. I'm sorry if I went a little fast.
Oh, no, and I think we're, because you did just fine, Sandra, we have plenty of time to take questions and answers. And I'm going to pause here and have everybody prepare for talking with us with your questions, but also we'd like to hear from the audience about what's working well in your comprehensive prevention plan in your county and what can we learn from it. And with that, Patricia, I think you said you were monitoring questions and answers in the chat. Do you have any to share?
Sorry, give me a second.
This is
Okay.
Nancy Kuster. While you
Okay.
work on that, Patricia,
Yes.
I'd like to add something. As a child abuse and neglect prevention team, the Child and Family Wellness Collaborative was very intentional in making sure that our priorities in this county were aligned. As a smaller county, we have limited resources, and we knew that it was through close partnership and collaboration that we would be able to enhance and sustain our child abuse prevention efforts. We were also very intentional about bringing to the table those who are truly able to have the ability to make decisions. And like what Lisa had mentioned, is having directors, executive directors, program directors participating actively in the collaborative so that we can truly make decisions to move forward with our efforts and collaboration. So aligning our shared priorities, aligning our limited resources in a smaller county we have, and then making sure that the stakeholders who truly could make those decisions to move forward our priorities were around the table. Thank you.
Thanks,
Thank you,
Nancy.
Nancy. So some of the questions, the first question is about sharing the PowerPoint. And I believe Gwen responded that it is available as uploaded in the document. So I just, we could confirm this. If not, if we could upload it.
I want to confirm that this PowerPoint is in the queue, as well as an example of a handout that we use to explain our collaborative to the Board of Supervisors and other stakeholders in our county, and the materials for the Parent Leadership Institute as well. So they're all in the UVA platform.
Thank you, Lisa, for confirming.
Yeah.
Then a question from Dennis Haynes regarding a screening tool to be used for choosing the parents.
Yes, so I replied to Dennis, and then there was a couple of other people. If you're interested in the screening tool, I'm happy to share with what we have. We just identified what that criteria looked like for our county and used an Excel spreadsheet. But I will follow up, and so feel free to send your emails in the chat, and I'll collect them before I get off and send them to you by next week.
Thank you, Gwen. Our next question from Veronica from Napa County. What funding you use to fund the parenting leadership group?
So I will take that on. This is Lisa Fraser, of the Child Abuse Prevention Council, also known as the Center for Family Strengthening in our county. The funds came through a contract that the Department of Social Services allocated to the Child Abuse Prevention Council. And those funds came through the Families First Prevention Services Act dollars. So that is what I can tell you today. And also in the future, how we continue to maintain this type of a project is the creative part of being a nonprofit. We do receive the Children's Trust Funds. So if you be aware of how your Children's Trust Fund is used in your county, as well as your community-based child abuse prevention dollars, or CBCAP as we call them in the sector. Those are examples of prevention dollars that are really designed for primary and secondary prevention purposes.
Thank you, Lisa. There's, I guess, another question tied to funding from Jose Espinosa. If you could explain how the parent stipends were provided.
Go ahead, Gwen.
Great question. So we have a certain amount that we give, which is $500 for their participation in the Parent Institute. And then part of the orientation is collecting a W-9 on the parent leaders. And they are then sent a check for the $500 at the end of the institute. And so being a nonprofit, we have the flexibility to be able to do that. And then as well as the stipends, the meaningful engagement opportunities are given through gift cards at different locations, wherever the parents have identified that they would like to receive those gift cards from.
And this is Lisa, I just want to comment that as a nonprofit, and I'm the executive director, we have an accounting team, an administrative team that we execute that process through. Once we have the instruction or the directive from Gwen and the parents' W-9 and they're signed a little agreement, then we facilitate the check process. So it's pretty straightforward. And next.
Thank you, Gwen and Lisa, for that. We have another question from Monica in regards to MI. Other counties who have implemented MI early on have experienced challenges with getting their staff who have been trained to reach the level of competence in the MICA tool. Have you experienced challenges with this? Do you have the percentage of those who have been trained that have reached the competence level?
And I can answer that. Thank you, Monica, for your question. I don't have the actual numbers on that, but our contract should be coming to an end in June, and we are going to be provided with a list of anybody who didn't reach the competency level or didn't reach the client-centered, which is like literally like under 5. And what we're doing in our department is we have a field-based trainer now who is working with child welfare staff. This field-based trainer is also one of our motivational interviewing trainers moving forward. So our plan in child welfare is to conduct an annual motivational interviewing training, and we will have a field-based trainer on hand. And if we notice or social worker supervisors know that there's maybe a problem with one of their staff, we can definitely give them some refresher trainings and some more support. And I think that oh wait, I was going to say I have another question there, but I'll wait for you, Patricia.
Thank you, Sandra. The next question is from Anna Castro. And the question is, have you been able to involve your school district into this work? And if so, how?
Yeah, I can answer part of that question. We do have, and again, this is Nancy Kuster with San Luis Obispo County. We do have the County Office of Education participating in our Child and Family Wellness Collaborative.
Thank you, Nancy. Then we have another question from Ana Escandon from Ventura County Probation, and it's regarding MI. Did you experience any issues when implementing MI with staff not, sorry, it moved. Staff not wanting to be recorded or fearing that it would be used as part of the performance reviews?
Well, I think with anything new, especially being on a recorded forum, felt weird. And our staff, they were told from the beginning that all of those trainings and recorded sessions were confidential. So none of that would be used as part of their performance reviews. And as far as staff who don't reach that client-centered, they were informed that only those would be noted to us, meaning like if there was a staff member that wasn't reaching that, we would give them additional coaching and additional MICA coaching and feedback so that they can reach that client-centered level. But it was very different. I mean, I did it and a few of us in this room did it. And it was, the first one was weird, but then after that, it was super comfortable and you can just talk to that actor and they were fantastic. Our trainer that we have a contract with coached them very well in motivational interviewing. So they already knew where they were going to be as far as their ambivalence level. And so they did a great job and it was really a good experience. But they also had the chance to bring up a case. So before they met with the actor, they can say, you know what, this is actually a little scenario that I have, and this is this is what's happening. And then the actor would then portray that and they would practice together. So that made it more of a meaningful session.
Thank you,
And
Sandra.
yeah.
And I think this probably is questions for you too. The question from Dennis asking who provided the training for the MI.
Yeah, we contracted with Motivational Interviewing for Change, and the contractor is Mary Beth Abella, and I think she's been in contact with the state also. I think they did some consulting in the beginning.
Great, thank you. And then a comment from Monica that it's a very smart approach to have a field-based trainer support staff with applying MI. And I believe those are all the questions. If there's anybody else in the group that has an additional question, we could welcome that at this time. Or if anybody from the San Luis Obispo team have any other comments, thoughts?
Yeah, I'd like to share that one of the lessons learned in creating this collaborative is that we are stronger together than independently working in preventing child abuse and neglect. Again, as a smaller county, our resources are limited. And we learned that we can't do this work independent of each other. Local nonprofit organizations alone would struggle to prevent child abuse and neglect, and child welfare services can't do it without our local partners. And so we rely a lot on our family resource centers and our family advocates to really not supplant, but supplement what child welfare services is not able to do. And so in partnering together, then we are holistically addressing prevention in all levels. And I think that's one of the biggest lessons that we've learned that we would like to share with the other counties. It's only really through the partnerships, because the government can only do so much. So child welfare can only do so much. And then the nonprofit organizations can only do so much as well. Thank you.
And this is Lisa Fraser. I want to echo on what Nancy has just shared. And when Nancy took the role of the Child Services Director for the Department of Social Services, we had to quickly learn about each other. And one of the things that most impressed me about our our beginning was that Nancy comes from a seasoned experience of being on the end that is receiving the calls into the emergency unit. And I want to just highlight how important that her experience and her lived experience has influenced her appreciation and knowledge of the prevention sector, and being part of this strategic thinking and development is really a critical role in her leadership. It's really valued by me and by this collaborative. The other part is that it really takes high level coordination to make it work really well. It can't be just like what Nancy said, it has to be intentional, and it has to be very intentional, not just with the people in the room, but with experienced facilitation and coordination. We were able to accomplish this with a partnership or a contract that I have with a high-level organizer who's a consultant, but also a partner in helping us to organize our collaborative. We're constantly reaching out to our colleagues. If we can please orientate them into the purpose of the collaborative so we have a better understanding of our value of our partnerships. That takes time, and it's an important part of the work. And in addition, I want to add that the way we landed on data sharing practice is a practice. It is a constant practice, and we have the support of a consultant at Corona Insights. They are experienced in helping us sort through how to identify not just what we want to know about data, but how do we actually practice this thing called data sharing. And again, the Families First Prevention Services Act funds has made this possible. And I want to thank our Department of Social Services in having faith and trust in this Child Abuse Prevention Council to do this work.
So will you advance the slide for the contact information in case
Oh, thank
anybody
you.
needs it?
Of course,
Thank
it's
you.
going to freeze, Sandra. Of course, that's how it works, right? Yep, it's freezing. It's funny how it will do that.
And we have one more question that came in from
Sure.
Shannon.
Oh, there it is.
It's once parents complete their 4-month commitment to the Parent Leadership Institute, are the next step sorry, this thing is blocking. Sorry, I apologize for that. It's blocking. Okay, so I'm sorry. Once
I
parents go
I see
ahead.
it, Patricia.
Thank you.
So once parents complete their 4-month commitment to the Parent Leadership Institute, are there next steps they take in providing advocacy services to parents, children in the community? And so, yes, this is something that is in development. We would love to have like a stage 2. So after they finish this foundational, to go into stage 2. However, we stay connected with our parent leaders and continue to invite them back year after year to whatever family strengthening efforts we have going on in the community. And then we provide them with webinars and things like that they can attend on their own. And then they're always welcome to join future cohorts and brush up on any skills. And so hopefully that helped answer your question. Otherwise, I'd love to talk more offline and have a more in-depth conversation.
Super. So it's 12 o'clock. Thank you, everybody, for your time. And I want to thank Nancy and Sandra and Gwen for their participation on this presentation. And Patricia, I'll just hand it off to you.
Okay, thank you, Lisa. Thank you everyone for attending our workshop this morning. Thank you for the San Luis Obispo team and the valuable information shared this morning. And so now I just want to share with you that we have lunch and the next workshop starts at 12:45. And thank you.